Hello everyone. Like most chronic illnesses, a stroke doesn't just suddenly occur. There are a lot of warning signs that a likely victim who is about to come down with a stroke will experience. Unfortunately, most people are unaware of these warning signs, and they ignore them until they break down with a stroke. That's why today we'll be taking a look at 9 warning signs of stroke an individual should notice 1 month before. The good news is that more than 80% of strokes can be prevented if the signs are detected early enough. Early detection also increases your chances of recovery if the stroke cannot be prevented, so let's begin. But before we take a look at the early warning signs of a stroke and how to prevent it, it's important that we first understand what a stroke is. What is stroke? A stroke occurs when blood flow to part of the brain is blocked or cut off. This interruption prevents that part of the brain from getting the oxygen and nutrients it needs to survive. It is a medical condition that requires immediate attention, as recognizing its symptoms early enough can aid your recovery process. But symptoms largely depend on what part of the brain has been cut off from blood supply and how much of the brain tissue is affected. Although stroke symptoms usually seem to surface quite suddenly, in most cases, there are a number of potential warning signs that must not be ignored. Let's look at 9 of these warning signs. Number 1, severe headache. The first thing a person who is about to come down with a stroke will experience is a severe headache. Generally, when it comes to health, it is important to take unusual headaches very seriously. Although it isn't always the case for all strokes, in most cases, a severe and persistent headache can be an indicator of a pending stroke. So it is important that stubborn and persistent headaches be examined quickly, as they could be an indicator of a more serious health issue. Number 2, transient ischemic attack. A TIA can be described as a mini-stroke. It occurs when blood supply to a part of the brain is interrupted for only a short period of time. Its symptoms are identical to those of a stroke, but they often disappear within 1 hour, rarely causing any serious damage. In some more severe cases, TIA symptoms may persist for up to 24 hours. It is estimated that 1/3 of the people who experience a TIA are likely to go down with a stroke in the near future. Though a TIA might be short, it is important that you seek medical attention once it occurs, even if everything appears to be normal afterward. So even if you ignore a severe headache, absolutely do not ignore a TIA. Number 3, numbness or weakness. This may be experienced on one side of the body, face, arm, or leg. If one part of your body suddenly begins to feel weaker than the other, then it is time to see a doctor. Strokes often lead to a partial paralysis, and the partial numbness or weakness of the body is a sign of an impending paralysis. Number 4, memory problems. A likely stroke victim might begin to experience difficulty comprehending, speaking, or listening to speech. Once you begin to experience difficulty understanding things that would normally be easy for you, that might just be a sign that you are about to come down with a stroke. Number 5, loss of vision. Another warning sign of a stroke is a sudden loss of vision or changes to your vision. As symptoms begin to intensify, one may also struggle to see clearly with one or both eyes. Number 6, loss of balance. A likely stroke victim might suddenly experience difficulty walking, dizziness, loss of balance, and a general lack of coordination. This is usually persistent rather than a one-time occurrence. Often, it appears as vertigo, a condition where the environment appears to be spinning even though it's not. This can have a profound impact on the individual experiencing this, as going about regular daily activities may become difficult or even impossible. Struggling to maintain balance while walking with no clear reason as to why this happens is another crucial pointer to the possibility of stroke. Individuals may notice they sway to one side or seem to trip, and will generally find it difficult to stay steady on their feet. Again, tasks that require coordination could become difficult to complete. Simple tasks like buttoning up or tying shoelaces become painfully difficult. Number 7, face sagging. This is a common early sign of stroke. As the illness begins to approach, the face of a likely victim might begin to sag on one side. The eyelids in the corner of the mouth will appear to drop down, and the person may struggle to smile. It is usually more noticeable on the lower part of the face. Number 8, slurred speech. Patients may also struggle to speak or begin to slur their words while trying to speak. This is usually due to the weakness of the muscles crucial for speech production on one part of the face. Some people will speak in jumbled sentences, while others will only be able to use a few words. In some cases, the victim recovers in a few hours or days, but for some it persists till a full stroke begins. Number 9. Seizure or fainting. Strokes occur as a result of an injury to the brain. This might lead to the formation of scar tissues in the brain, which can affect your brain's electrical activities. When this begins, one may experience seizures or fainting spells. If you notice any of these symptoms, we advise that you seek immediate medical attention, as this can help in preventing the occurrence of the stroke or increase your chances of recovery. Keep in mind that even though a stroke is treatable, most people who recover from the disease are left with certain degrees of disabilities for life. So the best option is to prevent a stroke by acting quickly once warning signs are detected. You should also imbibe a lifestyle that helps minimize the risks of a stroke. But what are the risk factors for a stroke? 1. High blood pressure. High blood pressure is a primary cause of strokes. Patients who suffer from high blood pressure are more likely to come down with a stroke. 2. Diabetes. People who suffer from either type 1 or type 2 diabetes are more likely to suffer a stroke compared to someone free from diabetes. 3. Heart disease. Heart diseases are the second most significant risk factor for a stroke. Studies have also shown that they are the leading cause of death among survivors of a stroke. 4. High levels of cholesterol. LDL cholesterols are known as bad cholesterol and can cause the arteries to be clogged up, shutting off blood supply to the brain. 5. Physical inactivity. Those who are largely physically inactive stand a higher chance of coming down with a stroke compared to those who exercise regularly. 6. Smoking. Smoking greatly increases your chances of getting a stroke as it damages the cardiovascular system. It also causes blood clots in the brain and ruptures blood. 7. Genetics or heredity. Some people are more prone to developing a stroke due to their family history. Like I said earlier, even after recovery, most victims of strokes have to live with a slight disability all their life. That is why preventing a stroke is the best option, and managing the risk factors is crucial for prevention. One good way to do so is to keep your blood pressure within a healthy range. You also need to know your cholesterol levels so you can know the right step to take. Depending on if it is normal or high, one should also adopt a healthy lifestyle. Quit smoking, exercise regularly, reduce alcohol intake, and eat balanced diets. Eat foods that are low on fat and cholesterol to maintain your cardiovascular health. Try to maintain a healthy weight, as obesity could also increase your chances of a stroke. Also, regularly monitor and control your blood sugar, especially if you already have diabetes. While doing all of this, if you notice any strange signs, quickly seek medical attention. Remember that those who get help immediately stand a better chance of recovering with little to no permanent defects. Even if the symptoms quickly go away, get help. Also, keep in mind that a vast majority of strokes can be prevented, so always be on the lookout for these symptoms. Also, maintain a healthy lifestyle, because I can't emphasize enough how important it is to prevent rather than to have to treat a stroke. If you enjoyed this video, like and subscribe to the page for more informative content. I'd like to hear from you. Drop a comment below. Also, if you want me to talk about something, let me know.